Do you think smoking is just a habit that affects your lungs? Think again. Smoking might be doing more harm than you realize, and it could be silently impacting your mental health. If you're one of the millions who struggle with stress, anxiety, or other mental health challenges, you're not alone. But what if smoking is making those struggles worse? It might sound shocking, but recent research is painting a clearer picture of the relationship between smoking and severe mental illness. And it's eye-opening. Understanding the connection between smoking and mental illness. Smoking has long been tied to serious health problems, like lung cancer and heart disease. But what about its impact on your mind? Studies show that smokers are at a greater risk of being hospitalized due to mental health conditions, like depression, bipolar disorder, and even schizophrenia. Why is this happening? Scientists have been digging into the link between smoking and mental illness, and it turns out that our genes may play a bigger role than we thought. Researchers from the UK Biobank analyzed over 330,000 people, looking at their genetic risk factors for smoking and mental illness. They found that smoking doesn't just correlate with mental health issues, it might actually contribute to them. This suggests that people with a higher genetic risk for smoking also have a higher risk for mental illness, and vice versa. So, the habit of smoking could be amplifying those risks and making it harder to cope with mental health challenges. Smoking, a cause, not just a correlation? Now, you might wonder, does smoking actually cause mental illness, or is it just something that people with mental health issues are more likely to do? While the answer isn't crystal clear, the evidence suggests a troubling trend. Smoking could be a trigger for severe mental illness, and not just a side effect. Think of it like adding fuel to a fire. If you're genetically prone to smoking, that same genetic tendency might increase your risk of mental health hospitalizations. Smokers often believe that smoking relieves stress and anxiety, but is this true? Dr. Marcus Munafo, a biological psychology professor, explains that this belief is often based on the temporary relief of nicotine withdrawal. In reality, the stress relief from smoking may actually worsen mental health over time. The reality: higher risks for current smokers. To get a clearer picture, researchers looked at when people started smoking compared to when they were hospitalized for mental illness. They found that those who began smoking before a mental health hospitalization were at the highest risk. And here's something even more surprising: former smokers had a higher risk than those who never smoked, while current smokers had the highest risk of all. So what does this mean? Well, if you're smoking now, you might be exposing yourself to an increased risk of severe mental health issues. Even if you quit, the lingering effects could still put you at a higher risk than if you had never picked up a cigarette in the first place. This doesn't mean quitting isn't worth it, far from it. The research highlights that quitting smoking can have incredible benefits for both your body and mind. Genetics and the role they play. This study sheds light on another fascinating aspect: the role of genetics. Researchers used something called polygenic risk scores to measure participants' genetic tendencies towards smoking and mental illness. They found that smoking behaviors and genetic risk for mental health hospitalization had a similar impact on each other. What does this mean? Imagine that your genes give you a higher tendency to smoke. This same genetic factor could also increase your likelihood of facing severe mental health challenges, like depression or schizophrenia. But it's not just about genetics. The effects of nicotine, whether you're predisposed or not, can significantly elevate the risk of mental health-related hospitalizations. A closer look at the study's limitations. As compelling as this research is, it's important to remember its limitations. This study focused on people of white British ancestry, so the findings might not apply to everyone. Also, the data came from the UK Biobank, where some details, like smoking habits or mental health symptoms, were self-reported. This introduces some potential inaccuracies. The researchers didn't look at how smoking affected different types of mental illness or explore other factors, like economic status, that could also impact mental health. Furthermore, they only looked at people hospitalized for mental illness. So, the study doesn't tell us about how smoking might affect mental health in people who are treated outside the hospital. To understand the full picture, more research across diverse populations is essential. Why quitting could transform your mental health. So, what can you do with all this information? If smoking and mental illness are linked, then quitting smoking might be one of the best things you can do for your mind. And for those who are genetically predisposed to smoking or mental health issues, stopping smoking could make a significant difference in your risk of facing severe mental illness. Professor Paul Avyard of Oxford University suggests that the belief in smoking as a coping mechanism is outdated. The increasing evidence that smoking may cause mental illness challenges that view. Stopping smoking might actually help to relieve the mental health struggles that many people try to manage with cigarettes. And in the long run, quitting could also improve your physical health, reducing the risk of major diseases like cancer and heart disease. Practical steps to quit smoking and support your mental health. Quitting smoking is not easy, but there are ways to make the journey smoother. Here are a few steps that can help. 1. Seek professional help. Doctors can offer prescription medications that reduce withdrawal symptoms. Behavioral therapies and counseling can also be effective, helping you change the way you think about smoking. 2. Build a support system. Let your friends and family know that you're trying to quit. They can be a source of encouragement and help you stay on track. You might even find that having someone to talk to helps with the emotional challenges that come with quitting. 3. Create a personalized plan. Everyone's journey is different, so take time to develop a quitting plan that works for you. This might include setting a quit date, planning for triggers, and finding alternatives to smoking. 4. Focus on mindfulness. Many people find that mindfulness practices, like meditation or breathing exercises, help to reduce stress and manage cravings. These techniques can also benefit your mental health overall, making it easier to cope with life's challenges without smoking. Final thoughts: a new perspective on smoking and mental health. The bottom line is clear: smoking isn't just a physical health risk, it's potentially a mental health risk, too. This recent research suggests that quitting smoking could offer powerful benefits for your mental well-being. But it's not just about quitting, it's about understanding how smoking might be impacting your mind in ways you never imagined. As the evidence grows, so does the importance of making informed decisions about smoking and mental health. So, if you're a smoker, or even if you're thinking about starting, consider this: every cigarette isn't just affecting your lungs, it's affecting your brain, too. Taking steps to quit could be one of the best things you do for your mental health. Remember, you're not alone, and with the right support, you can find a healthier, happier path forward.